Good morning. This presentation is on your professional identity and the characteristics of a profession. And that's what we're going to look at first. What are the characteristics of a profession? The first is that it has systematic theory and a knowledge base. That the skills that you practice and the knowledge isn't based on trial and error, but there's a theoretical foundation, and it includes foundations that are unique just to nursing and the inclusion of other scientific disciplines. Part of this systematic theory knowledge is theory. So, what is a theory? Just a set of interrelated constructs and definitions and propositions that present a systematic view of a phenomenon or a action by specifying the relationships between these variables. It describes what nursing does. It is describing the nursing interventions and how they apply and how they impact patients. The next is a paradigm. What is a paradigm? Universally recognized scientific achievements that for a time provide model problems and solutions to a community of practitioners. It's the behaviors and actions, which are the theories, and then paradigm is the lens through which we see the world. It's unique to each profession. It's the concepts, beliefs, and values that nursing believes in and practices under. So then what is a meta paradigm? That provides identity for the profession that's distinct from others. It's the concepts that are concerned with the profession. Um, and it gives nursing its identity. It's what we are concerned with. So the characteristics, these paradigms are persons, are human beings, a cultural being that survived time and space. It's the families, individuals, and groups and communities that we take care of. Next is the environment, the physical, social, cultural, spiritual, and emotional climate and settings where the people we take care of live, play, and work. All contextual aspects about it. Next is health, the focus of a particular type of nursing in a specific care, in the nursing home for geriatric care, in the behavioral health units for psychological care. And it's beliefs and values and behaviors that are culturally recognized and used to preserve and maintain the welfare of a person. So the health of a person is also influenced by their culture and their beliefs. And the last is this says care, and it's nursing care. So it's defined, nursing is defined by its activities and goals and services, um, as well as its actions to assist and support or train other individuals or groups to be a part of our profession. So the knowledge is the character. The knowledge and the theoretical basis. The knowledge is the one of the characteristics. The next one is authority. Authority is as how through education and experience where we gain professional knowledge and skills to make our professional judgments, what gives us the authority to practice our profession. Now, Benner, who's viewed as an authority in this area, has looked at the stages of clinical competence, how we develop from when we leave school as a graduate all the way up to stage 5. As you can see here as an expert. It goes through novice, advanced beginner, competent, and proficient, and then expert. And you can see each one of them kind of explains where we are as we develop into our clinical competence. As a novice or beginner, where we don't really have any experience except for what we've learned in school, and we're first starting out on a unit, we move through being an advanced beginner, where we start to be able to assimilate everything we've learned. Competent, after a couple of years where we're competent and we are able to practice, and knowledge comes readily to us. We've seen enough situations, all the way up to the expert who has practiced for many years and is now using their expertise to help others. This is where our authority comes from to be able to practice in our profession. The next is community sanctions. This means that society grants each profession certain powers and obligations to practice their profession. Um, ANA, the American Nurses Association, attributes professional nursing authority as a social construct with the community, and that the professional community is responsible for ensuring the safe and effective practice of all of the people who practice within their discipline. If you look here under the nursing's policy statement, the essence of the profession from the American Nurses Association, it says that nursing is a social contract. Under its terms, society grants to the profession authority over its own functions vital to itself and permits them considerable autonomy in the conduct of their own affairs. But in return, nursing, the professions, are expected to act responsibly, always mindful of this public trust, and be self regulating as far as our profession to ensure quality and performance that's at the heart of this relationship. It's the authentic hallmark of the mature profession. So, this is the expectation that the explained or social contract between nursing and the people that we care for. Another characteristic of a profession is its code of ethics. All professions have its own code of ethics. This is the link to the ANA, American Nurse Association's Code of Ethics, for which we practice under. That tells us what's legal and what we can and cannot do. As you get into 11, into the standards of practice, you will learn this specifically and apply it to different clinical situations to help you understand what your legal and ethical obligations are to your patient and to society. The last characteristic of a profession is professional culture. Now, the AACN, or the American Association of College of Nursing, wrote the Essentials for College Education Programs. It was the first national effort to really define all the essential knowledge, values, and professional behaviors that are expected of a baccalaureate nurse. When we are accredited, when nursing programs are accredited, this is what the accreditors look for. If that within the curriculum and the program, that these essentials are there and being taught to nurses to help prepare them for the profession. Part of professional culture is your continuing professional development. This means that you continue to get contact hours, CEs that are required for a license renewal, and that you keep abreast of the new practices within your area, and maybe even become certified. Also, professional organizations. Professional organizations help to promote our profession and move it forward. Um, there are many different ones. The American Nursing Association, I've already talked about, the American Association of College of Nurses, the National League for Nursing, as well as Sigma Theta Tau International, which is our honor society for nursing, and our chapter at Methodist is called Phi Phi, which people are inducted to at the end of the program based on certain kind of standards. So let's talk about professionalism in nursing. What is the standards of professional performance? Well, first it's ethics. Ethics is the ethical way we behave. And the next is educational background. Now, we sometimes confuse the public because to become a nurse, there's a diploma program. You can do an ADN or an associate degree or a bachelor's degree. Now, the diploma program is really just a 3-year certificate or a 3-year diploma. We really have only one left in the state of Illinois. Um, and then the associate degree program and our baccalaureate program. Now, research has shown that there are increased patient outcomes when the staff or the number of nurses have a higher percentage of baccalaureate prepared nurses to ADN prepared nurses. And so much so that magnet hospitals and those who have become magnet hospitals, they have the requirement to have 80% of their nursing workforce be baccalaureate prepared by the year 2020. So that kind of helps. They're trying to help the public understand why the baccalaureate degree is what all nurses should have. Now, if you look at the box 1.2, you can see the core competencies for health professionals that we need to provide patient-centered care, work in interdisciplinary teams, because we know when we work together as a team, patient outcomes are better. We know that we need to employ evidence-based practice, which we'll talk about in just a minute, and we have to utilize informatics. That means we have to know how to use all of the different electronic documentation systems or any of the kind of electronics that we use to care for patients. Many times you can even get a degree, a master's degree in informatics to help. The people who are developing these kind of systems aren't the nurses. So without nurse input, sometimes they don't work. They don't address how we really provide care. So we have to be in there with them, helping them understand how that documentation and those electronics need to be developed. The next part of being a professional is the standards of professional performance is evidence-based practice and research. So what is it? Well, it's the integration of research with clinical expertise and the patient's values for optimal care, as well as participating in learning and research activities. All nurses must participate in the advancement of our practice and through the development of knowledge, evaluation, and then disseminating this knowledge and evaluating it in practice area. So what does that mean for you in a baccalaureate degree program? Baccalaureate degree nurses need to know how to read the research, to be able to evaluate it to see if it is valid and reliable, and then be able to bring those new types of interventions to the practice area. Within the baccalaureate program, you're going to learn how to read the research articles. You're going to learn how to search for the kind of information that you need. In an internship, you're going to actually look at a problem on a unit and find by literature searching what has been done out there, what kind of research is out there to help address the problems you find. In baccalaureate programs, you don't do original research. That's usually saved for or done when you're in your master's or PhD program. Let's talk about the quality of practice. That's doing more than just performing the norm or what the tried and true is. It's really questioning to see if there's a better way to do what you do, and then trying to find ways to promote that, research it, bring different ways to increase quality of practice. Of course, communication. Communication is such a vital part of the healthcare environment, and it's where we have identified many different things get dropped because of poor communication, lack of communication, the wrong communication channels. So, becoming a very proficient communicator, understanding what you need to pass on to the physician or the provider or to the next shift, or what you need to communicate to the patient are very, so important, because when they go back and do root cause analysis, they found out many times it was lack or poor communication that's caused the bad outcome. Also, leadership. All baccalaureate degree nurses are expected to be leaders because you need to manage the team effectively. Um, in most organizations today, without a baccalaureate degree, you can't progress, so you can't be in a leadership position. Also, we see a lot of baccalaureate degree nurses being the leaders in the community and doing health promotion in their community. We already know about collaboration. It's collaboration with the family and the patient and all the other members of the healthcare team so that everybody works together for the benefit of the patient. And then professional practice evaluation. Remember, we talked a little about self regulation and reflection. It's personal accountability for your own knowledge base and for your own practice and for your own initiative to increase your knowledge and stay up to date with all the latest um, things that are happening and all the latest standards and ways we're caring for patients. A little bit about resource utilization or the environment. We have to be cognizant of what we're using, how we're using our resources. There's not enough resources for everybody who needs them. So first of all, we can't squander them, and we have to be sure that we use them to the best use, and that we evaluate what patients need so they also get the resources that they need. Also, a little bit about environmental health. The Institute of Medicine is a nonprofit organization that's designed to provide science-based advice to the public. They've the ones that have done a lot of the studies that have shown why, all the different poor outcomes we've had. One is called To Err is Human, Crossing the Quality Chasm. How, because it's such a huge system, all the healthcare environments, and the different things and the processes, and how can we make all those safer so that patients, all of those poor outcomes don't happen to our patients. Many times it's because of the processes and the way things are done, and many times it's just because we need to continue with our education. So, as you think about this and as you're reading your book, I want you to also think, what do you think a professional looks like? How do they behave? How do they dress? How do they communicate with others? Um, how do they take responsibility for their own development? Um, Also, think about, what does unprofessionalism look like? What do you look like when you're not professional? Um, Not following policies and procedures, not staying up with the latest technologies in your field. Um, and I want you to define to yourself what you think accountability is. What does it mean to you to be accountable? Accountable to your profession, accountable to your patient, and accountable to yourself. What does that look like? What does that mean to you? Also, what's a professional nurse concerned with? Well, we're concerned with the environment we work in. We want to be sure that the policies and procedures are designed to make safe environments for our patients and for ourselves to practice in. We're concerned about the type of education that students get, and that we all move to a baccalaureate focused education. Um, and what does a nursing philosophy mean? A nursing philosophy is your personal beliefs about your role as the nurse, about your interactions with the patient, and how you feel about health and healthcare. That's the end of this presentation. Thank you for listening.